Hi, Dr. Felton here with Beatrice Fern, and we're going to go through some basic shoulder stretches and mobilizations that we can do at home after a shoulder injury, or if we're recovering from a tendinopathy, like a tendinitis around the shoulder. So there's basically 3 moves. The first one is called scapula mobilizations, which is our shoulder blade. So you can find your dog's shoulder blade, even if they're not a greyhound. The shoulder blade, you can find like both of them, you can feel them up top, up here. It's like the top edge of the shoulder blade's up here. And the shoulder blade runs down to the shoulder joint, which is this pointy joint at the front of the chest here. And so to mobilize the scapula, you can press here and move it back like this. And you can press here and move it forward. You can see her muscles twitching just a little bit. And so we can work on moving the shoulder blade back and forth across the chest wall. The shoulder blade and the front limb aren't really attached to the ribs in a bony fashion. They're just muscularly held on. And so we can stretch all those muscles by moving the scapula about on the body wall like this. And so this is a good way to kind of warm up this area and like loosen up any adhesions or like tight spots, and kind of get a feel for how relaxed they are too. So I often start with this. The next stretch I call the Superman stretch, and it's really shoulder joint extension, which is opening the shoulder joint up as wide as you can. And so I like them in lateral recumbency like this, and then I keep their leg in the normal walking plane. I don't open the shoulder way up like this, and I don't press it down like this either. I keep it like right in the plane of walking that they would use like this. And I hold the scapula fairly still here in its kind of most relaxed position. And then I just gently open the shoulder up. I call this Superman because it's like she's gonna go flying, like Superman. And I just hold it right about where she gets kind of the tightest. We're opening up all the muscles, the triceps and the teres, all in the back of the shoulder girdle there. Hold it for 10 or 30 seconds. Tell her she's the best girl. Massage her a little bit. And then a bicep stretch. This is a little more complicated. So again, this is the shoulder joint where you can feel the point here. The bicep tendon runs right along the medial aspect, which is in here on the inside of it. And to stretch the bicep, you have to do 2 things. You have to flex the shoulder. So I'm bending this shoulder joint as deeply as I can. And then you have to extend the elbow at the same time. So like this. And she's tight there. That's all the further she wants to go. Some dogs will let you extend the elbow all the way back like this. But she's a little tight, and I can feel that. She kind of gave me a side eye and is like, that's about as far as I want to stretch that, and that's just fine. We're gonna hold it there. Again, I'm not opening this up really high like this or pressing it down really low in that position. I'm staying in the normal walking plane. I bend the shoulder joint and then try to extend, open up the elbow joint as far as I can. And that's about as far as B's got, so we need to work on that stretch more at home. Really important to do this on both sides. Even if we had an injury on just one side of our body, we would do these 3 stretches, then we'd roll over and we do these 3 stretches on the other side. Really important not to do this on a cold body. We want to, Lupe's helping right now. We want to be warm first, do a little dynamic warm up first, do some massage first, go on a really light walk first, and then do all these stretches. And each of these you can do 3 or 4 times in a row, and practice them over and over and over, and do them every single day, and work on getting extra range of motion and mobility out of the shoulder. Great job, B.